Hi, everyone. My name is Kalkidan. I am the program coordinator for the Women Respond in BSLA initiative at CARE. Today, I'm with my colleague, Emily Janik, who is the Director of Knowledge Management and Learning at CARE. We are both very pleased to be here in this learning event and introduce the CARE Women Respond platform and share our resources, learning, and tools with you. For you to be able to access it directly and eventually, if it's applicable, to use it in your own work. Before taking you through to the Women Respond platform and the resources, we want to give you a bit of a background about what the Women Respond initiative is all about and its objective. As you all know, the COVID pandemic posed a serious health, economic, and social crisis across the globe. As this crisis unfolded, it is increasingly evident that it was widening systematic inequalities that affect the most vulnerable. And at CARE, we realize that the efficiency of our response and the efficiency of the response of others will depend on our understanding of how marginalized people, particularly women and girls, are affected. Women experiences are central to the COVID impact and the COVID response as well. So we need to hear their voices. We need to, understand their experiences and the unique challenges they were facing and how they are leading in this crisis as well. So in general, the Women Respond initiative was inspired by the need to effectively adapt and respond to the gender dimension of the pandemic. Women Respond is all about listening to women around the countries where CARE works to bring their voices to the national and global stage and transform COVID-19 responses. And we do that by asking three simple questions. Of course, the actual question is more elaborated than this, but in general, what we wanted to understand is, how is COVID-19 affecting you? How are you impacted? How are you responding in your household, community? What action are you taking? And what do you specifically need? And often we direct this question to communities, and other times we might listen to segments of women within a community. And some of the examples are in the screen in front of you. By doing so, we want to bring women's and girls' voices into the decision-making platform. CARE uses this insight to shape our programming, improve our engagement with community, and improve our own responses. And what makes Women Respond unique is these findings go back to the communities themselves, particularly women and girls. In a way, they can use it for their own local leadership and local activism to amplify their voices and influences within their local context. We also share these findings with different stakeholders at national, local, and global level to influence decision-making by government and donors. Our aim is to widen access to this data and finding to create an open and interactive access to the findings. And in order to do that, CARE collaborated with Microsoft to create the Women Respond dashboard to share Women Respond data in three key areas that covers impact, action, and need of women during this pandemic. And our session today will take you through this platform and introduce you to the dashboard and some of the resources we have in the platform. And to give you that demonstration, I'll pass it to my colleague, Emily. Emily, over to you. Thank you.
All right, thanks. So I'm just going to pull up the screen here so that everybody can see the dashboard. So this is the Women Respond dashboard. It's publicly available on CARE's website, so you can go in and see this. And in order to do that, we've pulled out all of the personal data. So we don't want to put any participants at risk, but this is aggregate data that you can see. And on the dashboard, it represents 17 countries and over 6,000 people have given us responses in this dashboard. And you can see that we're, as Cal said, we're collecting data in these three areas: impact, action, and need. So you can check on the global view. This is the first view. You could say, here's what the biggest impacts are people are reporting. Here's what the biggest actions are that people are taking, and it will filter to that for you. And then you can also see, here's what people are telling us they need right now. This is the global view, but if you're interested in looking at a specific country, you can do that with these filters up at the top that you could filter by picking a particular country in the platform. And then we can also see, if you go to the second tab, this is in a Power BI dashboard. So if you go to this second tab, it shows you more detailed information about comparing impacts for women and men, looking at what is it women are doing to respond, and thinking about what are those highest priority needs. You can also, if you wanted to compare, for example, between different age groups, or you want to compare between women who are in savings groups versus women who are not, those are all filters that you can set on this dashboard here. So those are ways that you can look at this data. And then the third tab in the dashboard shows you more about our methodology. So where did the data come from? What are the questions we're asking? What was the consent process like to make sure that everybody understands how their data is being used? And then eventually we will build this to include more data on trends over time. So it's showing us some really interesting results when we look at this. We can see that particularly if you look at the actions women are taking and what are they responding, that women are very engaged in responses. More than 60% of women are involved in mental health care responses, trying to support people in their community. Nearly 90% are participating in community COVID mechanisms to try to prevent COVID in their communities. 55% are working with awareness campaigns and making sure that other people in their communities know about COVID symptoms, in some cases now also vaccinations where that's available. So those are the things that we're seeing across the board. And you can also see one of the things that we're starting to see looking in the data is if you compare women in savings groups to women who aren't in savings groups, they've been very resilient. And women in savings groups are about half as likely to report challenges and impacts as women who weren't in savings groups. So this is showing us from the voices of the women themselves really what their experiences are like and what that means about the way we need to do programming, about the advocacy we all need to do, and about what are some of the next steps that we can take to support people. And really that women are leading and we need to be supporting their leadership. We also are starting to build out more qualitative data because we know that numbers alone are not enough to tell us the whole story. So here are some examples of women and girls telling their own stories in their own voices. And we want to share one video with you. And this is with some girls who've been talking about what they would need to be doing more leadership than they already are. So I'm just gonna share that story with you now.
তো আমার যদি এলাকায় আমি করোনা থেকে মুক্ত করার জন্য বা সুরক্ষিত রাখার জন্য যদি কিছু করতে যাই তো আমার অবশ্যই সাহায্য সহযোগিতার দরকার আছে কারণ আমি যদি একা কিছু করতে যাই হয়তো সেটা হবে না হয়তো কেউ মানতে চাইবে না
gudunmuwar da za mu iya kawo ma al'umma shine sai wayan masu da kai wajen wayan masu da kai su danga aiki da matakan kariya taimakon da muke so wajen taimakar da wanga waye kan mutane muna da akwai bukatar babet da abun wanke hannuwa saboda sai tare da su ne za a samu a danga waye ma mutane kai
sai an tiga sai ga bara foi soro hakeli ala ni ker mali sababu uluna na te ko jimina de gumba de sai auma sai an tiga bara soro hake ala ni ker mali ko ni sababu ami ka sai ga don kan ya resta parce uluna na te ko jimina minunda mani contre pusher ni
হ্যাঁ যেহেতু আমি এখনো ছোট কিশোরী বয়সে এবং যে মাস্ক কিংবা সাবান পানির ব্যবস্থা করা আমার পক্ষে একা সম্ভব নয় এই কারণে যে আমার সাহায্যের প্রয়োজন
ma har yanzu ai hattara a rika sanya babet domin mu kare kawunanmu
আমি আমার এলাকার জন্য এই করোনাকালীন সময়ে কিছু করতে চাই তো যাদের আর্থিক অবস্থা ভালো ছিল না বা এখনো ভালো নেই তাদের তো আর্থিক অবস্থা আরো অবনতি হয়েছে তো এক্ষেত্রে আমি তাদের মেন্টালি সাপোর্টটা দিতে চাই যে তোমরা সুরক্ষিত থাকো ভালো থাকো এবং সবটা ঠিক হয়ে যাবে
All right, thank you for watching that with us. And I'm going to hand back over to Cal to do the last minute of what is our ask.
Thank you, Emily. As you can see, by making these resources widely available to everyone, externals as well, we want people to use this information, the different data and the different stories that you're seeing in your own work. We know that 15 minutes of intro is not enough to cover everything that is in the platform. If you're doing different research studies that is similar to this, you can also compare your finding and also feel free to share it with your network as well. Thank you so much for taking the time to listen to us, and me and Emily will be here to respond to some of your questions. Thank you.
Hello and welcome to this resource reveal session on facilitating virtual access to social and behavior change expertise for nutrition in emergencies. My name is Sona Sharma, and I work as the Social and Behavior Change, or SBC, advisor for the GNC Technical Alliance, Technical Support Team, and Action Against Hunger USA.
And hello, I'm Armel Sachet. I'm the Social Behavior Change Advisor for Action Against Hunger USA. And I'm a member of the GNC Technical Alliance Steering Committee for the technical support team. It is my pleasure to be here today to discuss with Sona about the resource that she will be revealing today. So Sona, maybe you could introduce this resource that facilitates virtual access to SBC expertise.
Not yet, Armel. Let's keep the audience guessing for just a few minutes. Let's first see what our colleague in Somalia has to say about this resource.
My name is Maymoon Abbas Abdullahi. I'm the Social and Behavior Change Coordinator for International Medical Corps Somalia Program. The need for technical support came as a result of our need to develop an SBC strategy. We were struggling to develop an SBC strategy for some time. And then this opportunity came in through our senior nutrition advisor, Susan, who connected us to the Global Nutrition Cluster Technical Alliance, which made this assignment possible. I thought we were a bit hesitant that the support may not be adequate because it was online. But as we progressed and we started our assignment, whereby we first started with the trial of improved practices and the trainings, and then conducted the trial of improved practice study through the support of Sona Sharma, and then we started working on the SPC strategy development. We felt that it was interactive, engaging, and hands-on. Even though it was online, we felt that our objectives were met. For me, the remote support was perfect.
Okay, thank you very much, Sona. So you talk about the technical support team, the TST. So let me explain a little bit about it. So the GNC Technical Alliance that we mentioned earlier is a common global mechanism endorsed by other than 40 global nutrition cluster partners. So it is led by UNICEF with the co-lead of World Vision International. So the TST of the Alliance aim to support practitioners improving the quality of nutrition response in emergency and humanitarian contexts by providing coordinated and tailored technical support. The TST has a large panel of expertise in nutrition, including integrated or community-based management of acute malnutrition, IMAM or CMAM, infant and young child feeding in emergency, IYCFE, nutrition assessment, and social behavior change for nutrition outcomes. So for example, social and behavior change in order to promote behavior linked to prevention and to treatment of severe acute malnutrition, to promote maternal nutrition or family diet diversity. So maybe, Sona, you could tell us a bit more about the type of technical support that you provide on SBC as part of the TST?
Sure, Armel. While each technical support is tailored to specific needs, the support provided could include capacity strengthening, design and delivery of trainings and orientations, conducting formative research, developing an SBC strategy and work plan, as well as support in implementing the SBC strategy, which includes development of communication materials such as posters or care group lessons, or even the production of a radio drama series. It also includes support in monitoring and evaluation design related to SBC, learning and documentation, and advocacy strategy development. To give an example, with IMC Somalia, I started with an SBC orientation, followed by a longer in-depth workshop to delve into the details of the SBC strategy development process. This was followed by a training and remote support in conducting the trials of improved practices and on other qualitative research methods. Once the team was trained, I was able to support remotely to ensure accurate methodology, while the team conducted qualitative data collection and analysis in the 4 program areas. Through follow-up meetings in all 4 regions with key stakeholders and community members, IMC validated their findings and collected additional information on reasons that prevent or enable behavior change. I supported the preparation for the meetings, which were facilitated by the IMC staff and were held face-to-face with due protocols followed for the COVID-19 prevention. The findings from the qualitative research, combined with feedback from the regional meetings, shaped the foundation for a virtual strategy development workshop, which I facilitated over 4 days with around 20 IMC staff joining from different regions. Once inputs were collected from all who participated in the virtual workshop, I supported the drafting of an integrated SBC strategy and conducted an online feedback session with the IMC team to review the draft. Ultimately, a comprehensive SBC strategy was developed that can be integrated into new or existing programs.
So this is just one example of the support that can be provided through the GNC Technical Alliance, as you mentioned earlier. But a much wider range of technical support is available on SBC. So this support is available not just remotely, but also in country that hopefully soon, when travel restrictions are relaxed, we are able to travel again. Our experience must, your audience must be wondering though, who can ask for this support and how can they access this technical support? So maybe, Sona, could you tell us a bit more about that?
Yes, of course. For that, let us take you through the GNC Technical Alliance website that you can see on the screen right now. As you can see, once we reach the homepage of the Alliance's website, you have the option of either checking the resources, this button here, or asking a question. This could just be a quick question on a technical aspect that you've been struggling with, or one that seeks to understand existing global guidance on nutrition during the COVID-19 pandemic. Relevant experts from the Alliance will revert with responses to your questions. However, in case you need more direct short-term or long-term support, you can go to the tab Thematic Areas or the next one on On-Site Support to understand the different types of support available. The thematic areas will show you the themes on which you can get support, whereas the on-site support shows the 3 types of support that can be provided. We talked about in-country support and remote support earlier. The 3rd type of support is that of a consultant roster, where if you're looking to hire a consultant to support your nutrition programs, the Alliance provides profile recommendations from a verified roster of consultants who you can select from and take them on board directly. To request for either kind of support, all you need to do is click the Request Support button, this button here on the top right side of the page, and fill up a very simple form wherein you give a brief description of the support that you need. The request goes directly to a dashboard that is constantly monitored by the Alliance team, and you will get a response within 24 hours. It's as simple as that. And of course, you can go through the large number of resources that are already uploaded on the website. So as per your need. So that's about the website and how to access the technical support. Another question that I'm sure is on people's mind is, do I have to pay to get the technical support? What does it cost? And will I be able to afford it? Amel, could you please talk about the cost flexibility for a bit?
Yes, so now this is a good question. So as these resources have been made possible with the generous donor of USAID, BHA, Irish Aid, SIDA, UNICEF, and Save the Children. So the costs are completely flexible, depending on whether or not, as an organization requesting support, you have budget or not for this support. It could be completely free for you if you don't have any budget set aside for technical support, and if it is in line with the project that all donors support, of course. However, there are also options where you could contribute partially or completely to the support, covering the time cost for the advisor, the traveling cost, or the activity cost in country, if it is an in-country deployment. So if you do have budget available for the project, for the support that is requested, then we will discuss to see how much you could contribute and what you could cover, what the project can cover. One of the main conditions to be eligible for this support is that the area where you are working must be focused on nutrition in emergency setting. Or, for example, you are doing food security and nutrition where there is high rate of malnutrition, where there is a disaster, where there is an humanitarian crisis, or you are working on preparedness activity. Whether or not you could get, let's say, free support because it will be taken by the donor, it will be discussed within the deployment steering committee. And the request will be shared with the donor as well. And finally, maybe Sona, you could summarize a bit the key takeaway for this unique resource and tell us a bit more about what did you learn about it during the application of the support during the COVID-19 pandemic.
With pleasure. The GNC Technical Alliance, GST, is available to provide high quality technical support to all nutrition practitioners working in emergencies, whether local and national organizations or nutrition clusters, or even the government at the country level. On receiving a request, the TST works with the requester to develop the package of support that best fits the need, from a quick response or a longer term support on an average 6 to 8 weeks, either full-time or over a longer period, both in-country and remote, or a mixture of the two, or simply provision of consultant recommendations. In parallel, the TST will identify the best individual or individuals to support the work based on 4 main parameters: the most local option available, the most appropriate available profile, available funding and administrative process, and the required urgency. And to your question about the lessons during COVID-19, I would say the 2 main lessons learned were the first one being that providing support remotely necessitated that support was less hands-on, and I had to move from direct support, such as conducting formative research myself, to coaching and mentoring the staff on site to conduct the research themselves. And this proved to be more sustainable in terms of capacity strengthening of partners. The second important lesson that I feel is that the virtual workshops can be made engaging and interactive by using different features such as polls, quizzes, collaborative whiteboard platforms, etc. But one must be prepared for technology problems, especially in humanitarian and emergency contexts, which will require us to be very flexible with the timing and schedules. So remote support can actually take longer than initially planned. But really, the best way to learn about this resource is to experience it. So to request for support, just go to ta.nutritioncluster.net and click on the red tab of Request Support. We hope this information has been useful for you. Thank you all, and look forward to interacting with you in the Q&A session.